I'm Jennifer Bernzinski. I'm the Associate Deputy Assistant Secretary for Human Services Policy here in the Office of the Assistant Secretary for Planning and Evaluation at HHS. And I'm so pleased to welcome you all to the kickoff for the Children's Interagency Coordinating Council. Before I introduce our first speaker, I just want to mention a few housekeeping items. American Sign Language interpreters are right here to my near right. If you need to be seated closer to interpreters, please feel free to move to a closer seat, or you can ask Gretchen Lehman, who has her hand up over here, for assistance in that. Also, throughout today's event, if you need anything or have any questions, please feel free to just go to the check-in table, which is back there, which hopefully you all saw when you came in, and someone will be able to help you there. For those of you who are joining on the live stream, if you're experiencing any technical issues, please email live.stream@hhs.gov, and someone will help you with that. So to get us started, I am very pleased to present the Principal Deputy Assistant Secretary for Planning and Evaluation, Rebecca Haffajee. And thank you, Dr. Haffajee, for your support on this issue. Welcome.
Thank you so much, Jennifer, and good afternoon, everyone. As Jennifer noted, I'm Rebecca Haffajee. I'm the Principal Deputy Assistant Secretary for Planning and Evaluation, or ASPE, and we are part of the Department of Health and Human Services. I'm really delighted to welcome you all and to this kickoff event for the Children's Interagency Coordinating Council. We are really happy you can join us today, whether here in person or joining us via live stream. So for some context, last December, Congress instructed HHS to establish the Children's Interagency Coordinating Council, or the CICC, to foster greater coordination and transparency on child policy across federal agencies. My office, ASPE, is leading the effort to stand up the CICC on behalf of HHS. And to share a little bit more about ASPE for you all, ASPE is the principal advisor to the HHS Secretary on policy development and is responsible for major activities in strategic planning, research and evaluation, policy coordination, legislative development, and economic analyses for the department. We conduct research, we translate the evidence for program purposes, we perform policy analyses, and coordinate and collaborate across the government in order to improve federal programs and systems for all American people. We particularly focus on administrative and HHS policy priorities, and children are no doubt a high priority for this administration. In our coordination role, ASPE leads the Interagency Working Group on Youth Programs and the Council on Economic Mobility, and we participate in several other federal interagency efforts around children, including the Coordinating Council on Juvenile Justice and Delinquency Prevention and the Early Childhood Federal Partners Interagency Work Group. We're excited to have the opportunity to apply our experience with interagency coordination and our expertise in federal child poverty and well-being policy by facilitating the establishment of the CICC. Our cross-cutting interagency efforts bring federal partners together across programs and agencies to work on common goals and bring a fresh lens to existing challenges. And really, combined and coordinated, the sum of all the federal agencies are greater than the independent parts. Over the past several months, our team has connected with key partners inside and outside of government to gather input for this CICC, many of whom are joining us here today. And we've learned so much from these conversations and would like to thank you all for your continued partnership and support. And it really is your partnership and engagement that will be critical to the impact and also the success of the CICC. We also want to thank Congress for entrusting HHS with this work, particularly former Representative Lucille Roybal Allard and Representative Barbara Lee for their leadership in creating the CICC. And we're thrilled that Representative Lee will be joining us later today to deliver the keynote for this welcoming kickoff event. Prior to her remarks, we have two exciting panel discussions. The first focuses on community perspectives, with speakers from a variety of backgrounds highlighting innovative strategies to reduce child poverty and improve child well-being in the U.S. The second features leaders from across the federal government discussing insights from their agency's efforts to reduce child poverty and improve child and family well-being, and to present opportunities for interagency coordination. We will also have a presentation from Dr. Dolores Acevedo Garcia on the National Academies of Sciences, Engineering, and Medicine 2019 report entitled A Roadmap to Reducing Child Poverty. To get us started, I'd like to introduce Dr. Meg Sullivan, who will be providing some opening remarks. Dr. Sullivan is a counselor to the HHS Secretary, Xavier Becerra. She is also a board-certified pediatrician and has extensive experience in public health, global health, and primary care. Prior to her current position, Dr. Sullivan served as the Chief Medical Officer for HHS's Office of the Assistant Secretary for Preparedness and Response. She has held public health leadership roles across the U.S. and practiced medicine at a federally qualified health center here in Washington, D.C. Please join me in welcoming Dr. Meg Sullivan. Thank you.
First, thank you, Rebecca, for that warm introduction. And hello, everyone. As Rebecca said, I am Meg Sullivan, counselor to the Secretary, and a very proud pediatrician. And I'm here, too, on behalf of Secretary Becerra, who I know would say many of the same things that I am going to say today. And first, we'll just start off by saying that ever since I first heard about this, we heard about Congress in December 2022, I've been looking forward to this meeting, I've been looking forward to this council, and I feel so honored to be here today for such an important event and even have the ability to speak. So really, I think it goes without saying that we strive every day here at HHS to advance the health and well-being of the American people. And one of our top strategic goals is to strengthen social well-being, equity, and economic resilience across the lifespan. We are committed to providing effective and innovative pathways that lead to equitable economic success for all individuals and families. And HHS seeks to increase safeguards to empower families and communities to prevent and respond to neglect, abuse, violence, while simultaneously supporting those who have experienced trauma or violence. We are also working to expand opportunities to help children and youth thrive equitably within their families and communities, and we all know how important those opportunities are. But of course, as we've already heard, we are not doing this work alone. There are so many other federal agencies that oversee policies and programs that address poverty and impact child and family well-being. And across the nation, you, others like you, and so many others are working to improve the lives of children in communities big and small. However, despite all of this work, unfortunately, we all know that child poverty remains a significant problem that has serious negative implications for the well-being of children, their families, and our nation. And we know that growing up in poverty has wide-ranging and long-term effects. A wealth of evidence points to the negative consequences of child poverty, including putting children at higher risk of experiencing behavioral, social, emotional, and health challenges. And as Congress has noted, the COVID-19 pandemic contributed to further decline in the economic standing, education, and physical and mental health status of low-income children, particularly among children and youth in Hispanic, African American, and American Indian and Alaskan Native families. In addition to the unacceptable health impacts, the costs of child poverty to society are also enormous, with estimates ranging from $800 billion to just over $1 trillion per year on lost productivity, increased health care, and other expenditures. In 2022, which is the most recent year for which we have data, the official U.S. child poverty rate, which is based on family cash income and direct cash assistance only, was 15%, which means that close to 11 million children were living in poverty. And unacceptably, children experience the highest poverty rate of any age group in the U.S. These numbers are devastating on their own. However, the overall child poverty rate masks significant differences also in who experiences poverty. Last year, more than 1 in 5 Hispanic children and Black children lived in poverty. For American Indians and Alaskan Natives, more than 1 in 3 children were in poverty, while in comparison for non-Hispanic white children, the rate was 1 in 10. Using the supplemental poverty measure, which takes into account a broader range of federal assistance programs and resources such as tax credits, 1.4 million fewer children were poor because they received the refundable tax credit in 2022. And this number was even higher in 2021, with 2.9 million fewer children poor, largely the result of a major one-year expansion to the federal child tax credit in the American Rescue Plan that expired in 2022. So we have shown that while the numbers are still way too high, we can reduce child poverty in the United States. And the Biden-Harris administration and Secretary Becerra and HHS are committed to using all possible policy and collaborative efforts to turn the tide on child poverty for good and ensure our children have optimal opportunities to thrive. So HHS is incredibly excited to lead this new interagency effort, the Children's Interagency Coordinating Council, to bring together executive branch departments to address these challenges. And as we do, it is important to learn from and build upon the work that has come before, whether that's at the national level or in states and communities. And as we already heard a preview, we will be hearing about several different efforts today aimed at understanding and addressing child poverty during today's event. And it is my honor to introduce the first presentation, which focuses on a formative research effort led by National Academy of Sciences, Engineering, and Medicine. In 2015, Congress instructed HHS to contract with the national academies to conduct a comprehensive study of child poverty in the U.S. in order to provide a nonpartisan, evidence-based analysis of the costs in child poverty and to propose recommendations for reducing the number of children living in poverty by 1/2 in 10 years. This effort resulted in the 2019 report, A Roadmap to Reducing Child Poverty. So I'm excited to introduce our next speaker, Dr. Dolores Acevedo Garcia, who is a member of the committee of experts put together by the National Academies to develop the roadmap. She will be sharing findings from the report and reflecting on what has occurred since its first publication. Dr. Acevedo Garcia is a professor of human development and social policy at the Heller School for Social Policy and Management at Brandeis University. Her research focuses on the social determinants of racial and ethnic inequities in health, the role of social policies in reducing those inequities, and the health and well-being of children with special needs. She's also the project director for diversitydatakids.org, a comprehensive research program and indicator database on racial and ethnic equity in child well-being and opportunity across multiple sectors and geographies. Please join me in welcoming Dr. Acevedo Garcia.
Good afternoon. It's an honor to be here today at HHS with so many wonderful colleagues that I've known over many years, and also with the task of talking to you about the roadmap report. So I have a few remarks and some slides to use just as a guide to the discussion. Oops, sorry. So the roadmap report was a report put together by a committee of experts convened by the National Academy of Sciences, Engineering, and Medicine. I want to give a sense of what the work entails because I think it's really important in terms of understanding the seriousness of the issue, of course, that require this kind of convening of experts and also how solid and rigorous the recommendations or conclusions are. We worked together for 2 years, from 2017 to 2019, as a committee reviewing the evidence and also commissioning to the TRIM3 group at the Urban Institute a series of policy simulations to know what the effects of different policy changes could be on reducing poverty. We worked very hard reviewing the evidence, having deliberations as a committee, writing, of course, the reviewers obviously took their task also very seriously, and then we reflected on the reviews, we edited the report, and I think we ended up with a very solid report that I invite you to read because there is obviously only so much I can do in 15 minutes today. So we also, I think many of us, including myself, we took very seriously the task of disseminating the report. And because it was a report, as was previously said, mandated by Congress, we had a wonderful audience of policy people interested in the report in the first place. So we went around, we continued talking to a lot of different people, and many of us continue to do research on different aspects of the report. For me, in particular, that means doing more research on how we can improve racial and ethnic equity in terms of child poverty. We have really vast inequities in child poverty that we need to resolve. And so it's very important that we take that task further. We, as a team, have done a lot of research on that, and I hope we can have further conversations about this later. So I want to start, before I summarize some of the findings of the report, by saying that we know how to reduce child poverty. This is not something that is mysterious or that we cannot do or is an intractable problem. We can resolve the issue of child poverty. We know what policies work. We know how to tweak policy design elements to achieve this goal. And we actually just did that recently with the expansion of the child tax credit. So I want everyone in this room, the council, and everyone that is listening online to just start with the position that we are responsible for doing this because we can. So we obviously have to change some policies in a certain direction, and that's what we're going to be talking about. Historically, in the last few decades, and also recently with the expansion of the child tax credit, we have been very, very successful in reducing child poverty. However, we have not been entirely successful. We still have a very high poverty rate, higher than other developed countries, that fluctuates between 12 and 13% of all our children, and that's between 9 and 10 million children, so a lot of children that should not be experiencing poverty. And we also have really vast inequities in child poverty by race, ethnicity, immigrant status that have been very persistent and that we have not been able to reduce as much as we should. So we need to continue doing this work, but we have enough information, enough policy knowledge that we know what to do. So I again want to start with the principle that we can do this, we know how to do this, and we should do it. We know that poverty has really serious effects on children, negative effects, and that was alluded to before. One of the tasks of the committee was to review the evidence that poverty causes negative effects on children, and we took this task very seriously, reviewing the causal evidence very carefully over more than a year. So poverty causes health problems in childhood and in adulthood, educational achievement deficits, also less than optimal economic outcomes when children become adults. And also, poverty tends to be transmitted intergenerationally, which is a very, very serious issue that we need to think about. There is a report that was recently published, another Academy of Sciences report on intergenerational poverty. And what we know is that of children that grow up in poverty, about a third of them go to continue living in poverty as adults. So we can avoid having that cycle and all the negative consequences that go with that cycle if we do something about child poverty today. That's another thing that we know. So that's a very quick summary of the causal evidence. Another part of the causal evidence that I think is fascinating is that we can look at the flip side. So what do we know about the effect of the programs that we have to reduce child poverty, such as the Earned Income Tax Credit? We have very rigorous research evidence, causal evidence, that the EITC not only reduces poverty in childhood, but has a number of really positive long-term effects on health in childhood and beyond, on education, like college graduation rates, on employment outcomes, and also on child maltreatment. So when we are not implementing the right policies to reduce child poverty, we have to be aware of our responsibility that we are not only responsible for making children experience poverty in childhood, but we are also responsible for denying them all the benefits that go with not living in poverty during childhood, which extend along the life course and are very positive for them, for the children, and also for society. So that's a very important lesson from the report. About the numbers, 12 to 13% of our children live in poverty. Again, that's between 9 and 10 million children. Our policies are effective. If we didn't have all the policies that we have in place, our poverty rate by the supplemental poverty measure that takes into account government programs would be about 22%. So we are being successful, and we need to embrace that and celebrate that, but we need to do more. And we have really vast inequities in poverty by race and ethnicity. About 20% of Black and Hispanic children live in poverty today. And we also know that since the early 2000s, the largest group of children in poverty in the US has been Hispanic children. 3.7 million children today, Hispanic children, live in poverty. So when we think about the design of policies, you would think, well, given that we have these inequities and that we have really large numbers of children from minoritized groups that live in poverty, our policy design should reflect that, and we should be doing something to close these inequities. Sadly, that is not always true. And my own personal opinion is that one way in which we are going to be able to reduce poverty further going forward is by being much more intentional about closing these gaps, closing inequities in poverty, because those design elements that would allow us to do that would also allow us to be more effective in reducing poverty overall for everyone. So what are some of the things that we look at as a committee? We divided policies in 4 areas, and of course, you need to have some kind of classification. People may think of another classification that they like, but we look at poverty policies that are tied to work, things like the earned income tax credit, minimum wage. We also look at safety net policies like the Supplemental Nutrition Assistance Program, SNAP. We also look at programs that are existing in other countries that have been successful, and one of them is a nearly universal cash allowance, which is essentially the expanded child tax credit that we just had. And we also did some restoration of benefits for immigrant families as part of the policies that we consider. So overall, we consider 10 different policy options, and we did 2 options for each of these programs. So in total, we calculated about 20 scenarios of what would happen to child poverty if we change these policies to make them more generous or more inclusive. And we also consider policy packages, so combinations of policies that could achieve the goal of reducing child poverty by 50% in 10 years. So some of the conclusions from this work that I want to mention today, just briefly, is that of the individual policies, the only one that can bring us closer to achieving the goal of reducing poverty by 50% is an expanded child tax credit. So it's very important to keep that in mind. And of course, we just did that in 2021. And another message from the report is that we need policies that are being combined in packages. And that's important because we are going to be able to address different issues if we combine policies that require work and safety net policies. I think that the issue of combining policies is also safer, because if a policy goes away, we have other policies that we can rely on. So those are some of the things that we found. The cost of reducing poverty by one of these packages, a couple of these packages that we found to be successful, is about $100 billion. So people say, oh, that's very expensive. But when you compare that to the $1 trillion, that is the cost of poverty to the nation, that doesn't sound so expensive. It's not that expensive. Okay, so let me go to the next slide. So where are we right now? So where we are at right now is, on one hand, I think a really positive emphasis from the administration's perspective on trying to reduce child poverty, on focusing on racial ethnic equity. We just had an amazing expansion of the child tax credit. that allow us to reduce poverty to a historical low level of only 5.2%, lower than it's ever been. And for Black and Hispanic children, this meant that their poverty rate went down from about 20% to less than 10%. So we know what were the elements that were successful in that child tax credit, and that was the size of the benefit, which was about $3,000, full refundability, no minimum earnings requirements. So we need to keep doing that. One of the things that we have to recognize with the child tax credit as it is now, not the expansion that we just had and we decided not to continue, 91% of children in poverty are not able to get the full child tax credit because of the minimum earning requirements and the lack of full refundability that is essential part of the design of the program as it is right now. So a program that should be reducing child poverty, the full credit is not available to more than 90% of these children by research from the Columbia University Center on Social Policy and Poverty. So in the absence of federal action, what is happening right now, which I think is very, very important to mention because it means a lot of experimentation and a lot of lessons are coming from the state level, states are taking action to enact some of the policies that we know to be successful. And I'm going to refer to three things: the earned income tax credit that is being made by some states more generous and also more inclusive by including children in immigrant families. Now we have 14 states that have instituted their own child tax credit, and they are including some of the design elements that I was talking about before, like full refundability, no minimum earnings, et cetera. And we also have now, I think a bunch of states are working on paid family and medical leave, which is another very important policy. This is not enough. We need action at the federal level, of course, but I think that it's good that we have this policy experimentation and movement in a good direction at the state level. Another issue that I want to mention in closing, which is also one of the interagency efforts that HHS is leading, is the issue of job quality or access to good jobs. So obviously we need safety net policies, we need tax credits, but we also have to make sure that we define jobs in this country in a way that includes compensation that is enough to be able to sustain a family budget, as well as benefits that all families need, such as access to health care. So there is a lot of work being done right now in defining good jobs, job quality, and defining measurements that would allow all of us, researchers and policy people, to track our progress to having more people that can enjoy quality jobs. So these are some of the main elements from the report and some of the new directions that I'm seeing in this field of poverty reduction, and I look forward to participating in the panel that will follow. Thank you.
Good afternoon, everyone. Welcome to the Children's Interagency Coordinating Council Kickoff once again. I am Miranda Lynch-Smith. I'm the Deputy Assistant Secretary for Human Services Policy, and I'm also serving as a senior official performing the duties of the Assistant Secretary for Planning and Evaluation. I'm delighted to lead the sponsoring office for this council. I'm really excited to introduce our panel and hear from them today. This panel will feature speakers from a variety of backgrounds highlighting innovative strategies to reduce child poverty and improve child well-being in the U.S., many of which have been implemented at the state or community level. We thought this important to remind ourselves that much of the creative and sustained work dedicated to impacting child poverty and well-being happens in our communities. And we thought it important to lay the foundation of the council by reflecting on those community approaches and thinking together about how we can use existing federal policy, programs, and research to uplift and support these approaches, maturing and spreading as we continue to do the work of looking to national transformational change. We'll start with brief remarks from 4 of our panelists, then we'll move into a full panel discussion to reflect on lessons learned and explore opportunities to impact child poverty and well-being. Our esteemed panelists are Andrew Costin from the Midlands Fatherhood Coalition, Dr. Willie Elliott from the University of Michigan, Administrator Wendy Henderson from the Wisconsin Department of Children and Families, Decoria Jones from Be Strong Families, and Dr. Dolores Avedero Garcia from Brandeis. Andrew Costin will kick off our panel. Andrew is a data and quality manager at Midlands Fatherhood Coalition, an organization that aims to strengthen families through father engagement. He helped develop and maintain the Columbia Life Improvement Monetary Boost, aka CLIMB, a guaranteed income pilot program in Columbia, South Carolina. Andrew, I'll turn it over to you.
Yes, thank you so much for having me. So the CLIMB program, again, Columbia Life Improvement Monetary Boost, was started, I think we were first approached in November of 2020. Mayor Steve Benjamin, who is the former mayor of Columbia, South Carolina, got together with some other mayors across the country and created the Mayors for Guaranteed Income. It's a coalition of different leaders and communities that really wanted to focus on bringing guaranteed income pilot programs to their cities. So there were already programs that focused on what guaranteed income looked like for teens, what guaranteed income looked like for mothers, and so they specifically wanted to look at how would it affect fathers in our community. So we gathered 100 fathers. They got $500 a month for a year, and we really wanted to see how that would impact each one of these. And there was no prerequisite for these individuals except they had to be a father and they had to live in Columbia, and that was the only 2. So we had a full spectrum of people who were fully employed, part-time employed, unemployed, even some individuals that were receiving disability. So it really ran the whole gambit of fathers. And there aren't any published findings yet. Those are coming in March or April of next year. But I do have some preliminary data to show. So it seems that about 30% of the money that was spent on food and groceries, 27% on retail sales and services, 23% on transport-related expenses, and 10% on housing and utilities. There were a few other areas that we looked at, but each one was a little bit less than 1%, 2%-ish. And really from the participants themselves, they mostly told me, because I was the one that had direct access to all of them, they mostly told me that they spent it on things like gas or toys for their kids or Christmas. Or there was one individual that told me, when I called him to tell him he was getting the $500, he cried on the phone, and it was really touching because he was wanting to take his daughter to dance classes and he didn't know how he was going to pay for it. And this really allowed him to do that. So our work at the Midlands Fatherhood Coalition is strengthening families through father engagement, and that's really what we focus on. I said, they asked me here to talk about CLIMB, and I said I would be remiss if we didn't also talk about the work we do in the community with dads. Because if you want to talk about reducing child poverty, I think one of the biggest steps is keeping the father involved, and that's just from our perspective. We really focus on keeping dad, if not in the house, keeping dad in their lives. So we want dads to be engaged financially, we want them to be engaged emotionally, and really be there for their kids. And there are a couple of stats that I have. I'm data and quality, so I'm always wanting to know about numbers. But is people without fathers in homes are 71% of high school dropouts don't have a dad in their home. 90% of runaways and homeless teens don't have a dad in their home. 63% of youth suicides, 71% of youth pregnancies all come from fatherless homes. And we're trying to prevent that. We're trying to fix this because a lot of the fathers we serve come from a home without a dad. And so they don't know how to be. You know, I was lucky enough to become a dad while working there, and I really learned all these skills that I learned from my own father to begin with. But we're seeing this across the spectrum in all the communities we serve in South Carolina, that people without dads are less likely to succeed. You know, they're more likely to live in poverty. And if we can help fix that, that's what we want to do. Whether it be, again, providing financially with child support, or just taking your kid to the park, doing something, being involved. And really, that's our main goal. Again, strengthening families through fatherhood engagement, which I think that about covers my time. So I will stop there.
Thank you so much, Andrew, particularly for sharing your preliminary findings with us. We'll look forward to that study in just a few months. But what I'm hearing really validates that income assistance gets spent on essential household needs and is supportive of family connection and well-being. So that's great to hear. Up next, we have Dr. Willie Elliott. Willie is a professor at the University of Michigan School of Social Work and the founding director of the Center of Assets, Education, and Inclusion. He is a leading researcher in the fields of college savings accounts, college debt, and wealth inequality. Willie, could you tell us briefly about your research and how it connects to child poverty and well-being?
I have to say first, I've been somewhat shook by how fast her cards come up, so I am worried about that. And secondly, how can I in 5 minutes say something that actually changes the course of HSS policy? I don't know, but I'm going to try to give you something. As the initial speaker was speaking, it dawned on me that most of our efforts, not the first time it's dawned on me, but it became much more clear, of our efforts are focused around income approaches to solving poverty. And I don't think that's totally misguided, but I think it is only part of what needs to happen. And so how can I describe this in some way is, think about it. When we see a poor kid, it's very alarming to us that they're starving and cannot eat. So we always think income first, assets later, right? We got to take care of that issue, that problem. But and that kind of works, even as we rattle off the numbers around the reducing poverty and those things through the child tax credit. I think that's real value in all that. However, we have a wealth inequality problem in life. And what does wealth do? Wealth augments what children can do. So even if we level the playing field, where we all get to eat, and we all have enough money to make it through a day, what about those extras that wealthy kids get that allow them to achieve even more with the same level of effort, same level of ability? If you ever read statistics, you'll find out that low-income children who are high-achieving don't succeed as well as low-achieving, high-income kids. There's just an inequity there with regard to wealth that income alone cannot overcome. And so until we understand that we can, like we do with student debt and everything else, try to attack the symptoms, the things we harm our eyes to see, and don't address true inequality, we won't get there. I will never have enough time to do all that. But I want to put that point on you, is that you really have to combine income and asset programs together if we're going to solve poverty long term. And so all of what you've done so far, I think, is only half of the problem. Children's savings accounts, what are they? Is something that I work with. I think there's a current version, there's a small dollar version. I think with baby bonds and some other things, you're seeing kind of large dollar ideas. And I think these ideas need to be combined to really have an asset approach that's effective, where you have a strong institutional structure through a children's savings account program that's combined with some real money in those accounts so they can pay for college, buy a home, do some of these things. What is a children's savings account? It's basically you don't think about the savings so much. Sometimes they're called child development accounts, but it's an asset account for building assets for low-income kids and minority kids. All kids get them, but it's really focused on low-income kids and minority kids. When you give them this institutional structure, and hopefully we can get to some of that maybe in Q&A or something, what you're giving them is the opportunity not only for a substantial initial deposit by federal government into those accounts, but you're giving them a structure that allows for multiple streams of assets to flow into them. And so when we think about tackling wealth and equality, I love the baby bonds program, but your $40,000 is not going to solve wealth and equality. I'm sorry. You also need to have community investment. You need to have individual investment. You need to have a vehicle that allows for donors to put money into these accounts, right? So when you give a kid an account, even though it's in the individual kid's name, it's really a community account. For all, and I can give you case studies in New York City and other places where they're using these community accounts to build wealth in these accounts for kids. Now, what we haven't had is that large federal investment yet, which you'll also need. And we find ourselves, there's like 8 key principles. I got a minute, so I'll say those real quick, and hopefully we can just get to questions and answers. When you think about a national policy, these programs will be, everybody's eligible for it. Automatic enrollment, so you won't have to sign up for it because there's all kinds of things that prevent people from signing up for things. Automatic initial deposit, so you would have that large federal investment in the beginning up front. You would start young, so you have time to build assets over time. Traditional targeted additional deposits, so low-income kids, it needs to be progressive, and minorities would get more in their accounts than others. Centralized savings plan, investment growth, so they would build assets over time, and a simplified investment option, so they're not overly complicated. I'll stop there, but hopefully you take from the first point there that we really need to combine assets and income to solve poverty.
Thank you so much, Willie, and I really appreciate that you reminded us that poverty reduction and even poverty elimination is frankly a low bar, and that as we are working to get to that goal that we haven't gotten there yet, but we should also be thinking about ways in which we can support wealth generation, individual, generational, and community. So I appreciate those thoughts from you. Next, we have Administrator Wendy Henderson from the Division of Safety and Permanence at the Wisconsin Department of Children and Families. As the State Child Welfare Director, she has partnered with counties and tribes to expand supports for children being served with their families. Administrator Henderson, I'll turn it over to you to tell us more about Wisconsin's effort to reduce and prevent child welfare involvement by providing economic supports.
Thank you. So I'm here to tell you all that the child welfare system is really not what you think it is. Most of people think about the child welfare system, you're imagining that story in the paper, that horrendous situation, and those things happen, unfortunately, but the vast majority of child welfare is not that. It's child poverty. We have seen the increase in Wisconsin and across the country of the percentage of cases that are there for neglect. In the last 15 years in Wisconsin, it used to be 35% of our substantiated cases, the ones that they said something happened that shouldn't have happened, were for neglect. It's 65% of the cases now. And so the child welfare system, unfortunately, is starting to get kind of good at this. Right? So we're starting to provide concrete and economic supports. We are asking the federal government to approve as an evidence-based prevention program for child welfare, housing, child care. So the question that I always come back to is, if you can solve it by writing a check, was it ever actually child welfare? Because I think what people think of when they think of the child welfare system is parents who are intentionally harming their children. And the system response used to be that we would take that child out of danger and we would put them in foster care. And so now we have a concerted effort, which is a good thing, to keep kids with their parents. And so now we have a lot more kids that we're serving in home. In Wisconsin and nationally, we have way fewer kids in out-of-home care. We've seen a 40% reduction in just the past 5 years in Wisconsin. We have 5 fewer children per day that are being removed. So we are keeping kids with their families, but how are we doing this? We're giving them money. Because what we have learned is that the way that we used to deal with family homelessness being a huge issue in Wisconsin, especially in December, right? And so you see a family that's in front of you and you say, this child is unsafe because they are living on the streets of Wisconsin in the wintertime. And so the most illogical response as a system, and what we've been doing for a long time, is saying, we will remove that child from that danger. We will put them in a foster home. We will go through the court system. We will do some concurrent planning to see who might be willing to adopt this child. We will go through a termination of parental rights, and we will have that child adopted into a family who can provide a home. And what we're learning is, why it took us this long, it's actually a lot easier to provide a house for that family, and it's a lot better for the family. But the problem is that these are different budgets, they're different ginormous systems, and so we're piloting some of this stuff in Wisconsin. It's incredibly successful. Do you know how powerful it is to be able to say, as a state, we have a tiny pot of money here. Wisconsin has given no new money under the new federal law that helps us keep kids with their families, nothing. So we have a tiny pot of money that you can use to pay rent for a family so that you don't have to use family separation in 3 counties out of our 72 counties. And it's working, and these families are staying together. And so what we've essentially done is we've opened a back door to TANF. That's what we're doing here, right? The front door has been relatively closed. We've gone from, in my lifetime, we've gone from 80 out of 100 families that need basic assistance being able to access that in Wisconsin. In 2020, that was 20 out of 100 families. So we just have a lot of people who can't access the basic things that they need. And what we've done in child welfare is we've said, come around the back. We're going to open up this back window, and we can get you the economic support that you need. We can get you a little bit of child care. We can get you through, and we know that it's better for kids and families. And so we're at a real danger point right now. We need to relook at the child welfare system. I would argue that a child protection system really should be there for the kids whose parents are intentionally trying to harm them. And we can't find those kids for the 70,000 calls that we get a year that are coming into our hotline, not because kids are being terribly hurt, but because families are in need. And the problem is going to be when we say, we can't do that well, so we're not going to do that. We're going to be here for the kids whose parents are trying to harm them. And the rest of those social supports, the child safety net, that's not us. We're child safety, not the child safety net. But there's nothing on the other side. And what happens every time people look at child welfare and they say, well, if there's no one else to step up, then I guess it has to be child welfare. And the problem with that is, for those of us who are parents, if the only system can help is also the only system that has the power to take your child from you, we have landed in a really bad spot. And so I'm very encouraged. I'm thrilled to be here today to be able to help be part of the solution, and happy to paint the picture for you all. Thank you.
Thank you so much, Administrator Henderson. Your remarks really hit home that addressing child poverty and meeting basic needs can prevent system involvement that in itself can be traumatic for children and families, and also helps us keep in mind the need for cross-system, cross-policy approaches to addressing this issue. So finally, we will hear from Takoria Jones. Takoria is a parent advocate at Be Strong Families. She has held numerous parent leader roles with local and state advocacy groups representing parents and children. So Takoria, please tell us about how additional resources, such as with the expanded child tax credit, impact the families you work with and advocate for.
Sure. Well, thank you for recognizing parent leadership. It brings acknowledgement that in this moment we are peers, and insight, knowledge, experience, actively working to create good policies for families and communities. Stable income is a core strength. Strong families are better at supporting their children. Consistent income reduces so many risk factors, and it enhances and enriches lives. It sets families on the path to thriving. Considering welfare as a cash payment, we saw that it did decrease long-term system involvement, but it surely was not the perfect answer. It came with negative social implications, and those social implications are out of the control of the people they most damage. Policies and practices like redlining and property value assessments, land use managements have effectively closed off managing these implications. And we, the village, want you to know that it's okay if you don't want to live where we live. we live there. We want to thrive there. We want good quality health food choices, open outside green spaces, and accessible means to educational, training, and entrepreneurial opportunities. Respectfully, I come to these places as an individual citizen leader to provide ongoing evidence of innovative mindsets in everyday people. I love National Geographic. As a child, I traveled the galaxy in those pages. I particularly love the large open savannas. I spent hours immersing myself, but I've only ever looked at pictures that other people took, only read other people's words. I'm missing the active insight, the experience of being there. Yet so many policies and practices are made without such active insight. Siloed agencies are 1,000, hundreds of thousands of layers tall, and even on the ground floor, the windows are small. The experience as everyday citizens contains valuable, necessary information, the active insight element. Data to me means discovering all the angles. We need to see the whole iceberg. We need to be ever mindful to connect with each other, to keep in perspective our differences are only skin deep. Problems have solutions. It is possible to consider active insight, beginning with design. At Be Strong Families, we recognize the value of this active insight. The Family Serving Arm works collaboratively by co-creating programs and services with parent leaders. The organization has thusly grown stronger in presence by recognizing the authority and governance and the value of experience. I sit on the board as the secretary and the co-chair of the Board Development Committee. Active insight can be designed. I actually am working on a tiering and leveling model that informs lived experience participants, grant funders, and philanthropic workers, and agencies and organizations who want to know how to gain the necessary and valuable active insight. Discovering all the angles is true cooperation. We are all in this together. Data has a heartbeat, and percentages are real people. We are all living with the effects of policies and practices created in different times by different people. Many of those ideas and choices around policy and practice are inappropriate for a thriving 21st century society. I don't promote myself very much. Maybe that's something I should work on. But I've done a lot of work with the ACF and SAMHSA. I see a friend in the audience around Families First and the Thriving Families, Safer Children work that's going on with injury prevention at the CDC, with Casey Family Programs, with Annie E. Casey, and with Prevent Child Abuse America, and with our partners at the Children's Bureau and ACF. And I sit on the executive level there. So I am a citizen, but I am here sharing these words with you all. Thank you.
Thank you, Takoria. You remind us that our fragmented federal system is really felt at the parent and family level, and that as we design and redesign policies, we need to both recognize the humanity of parents and families and have them at the center, have them lead the way as we consider new approaches. So thank you all for those introductory insights. We're now going to transition to a full panel discussion. I think we're going to have time for a couple of questions that I'm going to ask of each of you. Our first question is, based on your experience and what you've heard from others on the panel, what lessons or insights do you want to highlight for those of us working at the federal level to reduce child poverty and improve child well-being? So Dr. Acevedo Garcia, I'll start with you, and then we'll go down the line.
Well, that's a big question. So I think that for me, the question of equity remains central to the issue of child poverty and many other social issues. And I think that it's encouraging that at this point we have an administration that recognizes that it has to be, the issue of equity has to be embedded into to how we think about policy. And I think that I do hope that the Interagency Council, as well as any federal efforts and state efforts to reduce poverty, think very intentionally about how the policy design is related to whether we reduce inequities or not. And that is not something abstract or intangible at all. It's something that we can all understand in a very concrete way. To go back to some of the points that I was trying to make before, we know that requiring minimum earnings for something like the child tax credit has very exclusionary effects. We know that by doing that, right now we are excluding about 40% of Black and Hispanic children from receiving the full tax credit, child tax credit. And we also exclude a very large number of white children, 17%, but we obviously have a huge racial and ethnic inequity. And we are excluding the very children that have the highest poverty rates. Another issue that I don't think that we have to keep thinking about policy as something that like it's magic and it's a black box. We know exactly what we are putting in, and we know exactly what we may be able to get in terms of outcomes. Another issue that I think that we just need to tackle at some point, hopefully sooner rather than later, is the way that we're excluding children in immigrant families. I want to give a very concrete example that for me continues to be something that is sobering and very, very serious and we need to address. The Earned Income Tax Credit is the program that is probably the most successful in reducing child poverty. 18% of children in poverty today who are U.S. citizens are excluded from receiving this benefit because they live in families that are mixed status families. So if you have even one person on your tax return as a family that doesn't have a social security number, you don't get the EITC. So for a family of 4 with an income of about $25,000 per year, getting the EITC would get them an additional $6,000 per year, which is a huge amount at that income level. If you are a U.S. citizen child in a family in which one of the parents doesn't have a social security number, you wouldn't be getting this at all. So we need to be talking about these things in a very concrete way and think about policy design as something that we know about and we can control, and we need to think about the outcomes that we want.
Thank you so much. So same question to you, to Coria.
I did some work on a think tank with the ACF around child tax credit. And it just really, it kept dawning on me, these big hallowed halls, a lot of people come in and they're so big and everybody's like, wow. And in my hall, there's cat litter and laundry, right? But at the same time, the things that are happening in these hallowed halls are creating the environment for my hall with the cat litter and the laundry, right? So just really want to further insist that even with all the information and research and data, the need for active insight, the need for lived experience cannot be ignored. It cannot be set aside. It cannot be saved until later, because we in these hallowed halls are affecting the halls of our homes, the lives of people. So living in poverty only reduces the money you have. It doesn't reduce the love you have for yourself, your children, your community, your hopes, dreams, desires, that mindset that you have, the person you are. None of those things are reduced from living in poverty. Only access to money and the things that money can do. And we know that money stabilizes and increases the opportunity to thrive. And don't we all want to thrive? And as we think about thriving as a nation, we have to remember that my doing better is your doing better, and your doing better is my doing better. So if we all do a little bit better, that does better for our nation.
Thank you so much. Wendy.
So I think that there's been a little bit of confusion around the role that child welfare might be able to play in preventing child welfare involvement. So I'll just say it here, child welfare is not the agency that can prevent child welfare involvement, right? Lots of agencies in this room can help in that front. And so we're in a situation where you have a group of people who really went into a field to help families. And that is the absolute mission and charge of child welfare. And so given any resources to do that, people will step up and try to do what they can. But the problem is that then we have a lot of scenarios where kids are not getting actually what they need. And I would say that it's not a problem that there's not enough money. We spend, by the time a child gets to the deep end of the child welfare system, I regularly approve rates of $700 a day for a residential care center. And these are places that we know don't do particularly well with kids, right? The idea that we're going to take 60 15-year-olds in crisis and put them all in one building and see how that works out, I think any of us would have designed something better for their own children, right? But that's what we do in the child welfare system, because you get to a point where a child has been through so much and they've had so much trauma that people don't exactly know what the right response is, and I don't think that we've landed on that very well. And so now we're coming back at it from another angle, and we're saying we got to help kinship care relatives, because people who know and love kids are going to be able to do so much better. But now in Wisconsin, at least, we give kinship care relatives $375 a month. Starting on the first of the year, it's $300 a month right now. And so the disparity in what we are willing to support once a child is sort of in that formalized part of the system versus what we might do for a child's family of origin, for their relatives, is such a chasm. And it really doesn't make any sense, because we know that kids are going to do better with their relatives, with people who know and love them. And we can do that. That's TANF dollars, which we're sitting on, quite frankly, in Wisconsin, probably hundreds of millions of dollars of TANF, because we're unable to get it out the door. And yet we have all of these families in need, all of these children in need, and then when it gets to the deepest end of the child welfare system, we'll spend $700 a day on a residential care center. And so I think that if we're able to really take on board the idea that we can keep kids in their communities with their families outside of the child welfare system, and we can focus like a laser in the child welfare system on the children who need child protection, we are going to do so much better for children and families.
Thank you. Willie?
Yeah, awesome points. Quickly is, I have kids, and when I used to, I had a bike when they were young, and it had like a little parachute on the back. It wasn't really a parachute, it was like a trailer, and the kids would ride it back. But it felt like a parachute, and I would ride around the block, and my wife and my son was in the trailer because he was youngest, and the two girls would be on their bikes, and I felt like I was pedaling so hard to try to keep up with them, and it really was. I mean, I was pedaling so hard, and I was losing, and I couldn't understand. And then one day they went out and bought me a really nice bike. And then we went out for a ride around the block, and all of a sudden I could keep up, amazingly. I mean, I didn't do any more exercise, nothing else changed. I just got a better bike. And what I'm trying to say is, I used to have pictures, and I can show you this. But assets are like that. When we think about equity, it really is not only about feeding the kid, do I have access to a bike, but it also is about, do they have some wealth to be able to compete in a world full of people with wealth? And so we just have to change how we think about how we're going to really solve poverty long term, and not just quell down the symptoms, but put them in a position to where when they get that degree, and there's a lot of evidence now that shows that low-income kids and minority kids don't get the same return on a degree as other people, that they can leverage it and use it in the same way. They can't do that without assets.
Thank you. Andrew?
Yes. A lot of great points made today. And I'd say, really, I'd have to agree with Ms. Jones in that if you want to affect change, you should have people that do it on a daily basis in these conversations. Because there are, I mean, plenty of ways that you can affect poverty, and it's not just throwing money at it. Because, again, if you give money to a parent that doesn't know how to spend money wisely, then they're just going to blow it on the same things that they've always done, and the child's going to be in the same situation. And that's really why we focus mainly on building a better parent as a whole. We deal in 4 major components, which is healthy relationships, parenting, economic mobility, and health, to try and really deter the parent from making the same mistakes that they've been making. And we do get a lot of parents coming to us from Child Protective Services, where, a main point that I always point out whenever we're going to ask somebody for funding or just giving an update is on how many parents succeed in our program that come from DSS itself. I think we're right on track to hit about 80% of parents that come to us either get to keep their kids in the home or get their kids returned back to them because of the work we do. And if you really want to talk about changing the child's poverty situation, keeping the kid in the home is the ideal situation. We know it's never going to be 100%, but if you can take a parent, really change their mindset and get them to think about how to be a better parent and give them those tools, I think that in and of itself is going to create a different environment for a child and ideally would take that child out of poverty.
Thank you. So I'm going to go on to our last question, just 2 questions for us, and I'm going to reverse order, so heads up. And I want us for a second to be a bit hopeful and think about what are those opportunities we see for people with lived experience, community-based organizations, states, and the federal government to have an impact, a positive impact on child poverty and well-being in the next few years. So what gives you hope, or what opportunities do you see?
Right. There's a few different things that we're doing right now in South Carolina that I think are great. We just started a housing to home ownership program for parents that are moving around a lot or are living in an apartment or renting, trying to get them to move up the spectrum of home ownership towards owning their own home, which is great, and we're getting funding for that. We do get a majority of our funding from ACF and really focusing on that aspect of building a better parent. Mm-hmm. And I think the longer we get away from COVID, the more people we're serving, which is wonderful, because that was a real detriment to us. But every year since, we've actually been increasing and increasing, and we just got to the point where we're getting back to pre-COVID numbers. I'm really hopeful about that, because the more parents we can serve, the more parents we can touch, the better the children are of South Carolina.
Great, thanks. Willie?
A couple quick examples. One is in St. Paul, Minnesota, and we're doing a randomized controlled trial that combines children's savings accounts along with the guaranteed income, along with a targeted deposit in that account, which is kind of like a baby bond piece. They're getting $1,000 into their accounts each year. And so I do think, even much as I've talked about the importance of wealth, I'm not telling you that income is not important, but I just think we need to quit that income first, assets later, and combine those types of programs together if we're really going to solve poverty long term. Secondly, I would point you to Senator Casey's proposal around his 5 freedoms. Part of it is around children's savings accounts as one of them, but a large dollar savings account program. I've been in talks with them and Senator Cory Booker and others, but anyhow, he has a new proposal coming out sometime soon, and it really does build on the kind of infrastructure that's important to allowing multiple streams of assets to flow in. In his 5 freedoms, he also includes a child tax credit in that. So again, I think this is the marrying of the idea of a larger deposit within an asset building account that allows for community investment and involvement among community members to figure out how they build that out is a way to really tackle poverty long term. Lastly, I would add in some financial literacy and financial capability types of programs along with that.
Thank you. Go ahead, Wendy.
So I think we're getting so much better at strengthening family connections than we used to be. And that's really giving me hope for the future. I spend time every year at an overnight camp for kids who have been separated through out-of-home care. And they're giving us suggestions. So when we think about the lived experience component of it, we think about all the barriers that we might think are in our way to doing what's right for kids and families. And I'm talking a little bit about some child well-being stuff right now. And one of the girls at this camp pulled me aside this summer and said to me, I realized that in a regular year outside of this camp, I see my siblings less across the whole year than I would in one weekend if we were at home together. That's powerful. We can run all the data that we want, but I think that until we start really listening to the individuals who we are out there serving, we're not going to hear it the same way. That got me back to my office motivated, saying, what's in the way of these sibling visits? These are kids whose parents are, not able to parent them for one reason or another, but now the kids have to lose their relationship too. And so I just want to lift up Ms. Jones and her words, and we are working so hard in Wisconsin. We've hired our first lived experience strategic advisor to help us really not sit in our offices in Madison and develop these beautiful policies that won't actually work in the field, but really listen to the individuals who are affected by the policies. So just would really underscore that.
Thank you.
Discovering all the angles, really looking at what happens, the active insight of lived experience. I really love Willie's example about that bike, because when we're thinking about when parents are making choices, what are they choosing from? They're choosing from raggedy bike number 1, tore up bike number 2, and bike with no wheels number 3. So of course all of those are not good choices. So really thinking about how consistent income and understanding of situations like that can provide better choices, and then better choices make for better outcomes. Just really want to think about this Children's Interagency Coordinating Council and hoping that there is design in place to have people like me involved. Regular, everyday citizens. I don't come from an agency. I was found in this work and continue to do this work. And we're out here, ready and willing to uplift our experience to help and to further good process and good progress in this work. So really hoping that we continue to scaffold these silos, because there's so much opportunity out there. The National Family Support Network has so many FRCs that really support family and parent engagement and parent leadership. But you have to be a parent to know about that. And that's why that active insight is so valuable. And I do hope sincerely that the CICC goes hard in getting parents involved.
Great. Dolores.
So just very quickly, because we are being told that we don't have more time, I came to DC from Newark. I attended a meeting of the Robert Johnson Foundation of their Healthy Children and Families Grantees. And I was very, very inspired by the number of people at the state level that were at that meeting that are working towards better EITCs and CTCs at the state level. So I think that we have to be paying a lot of attention to that work and gathering lessons from that work. And also we have the Tax Cuts and Jobs Act that will expire in 2025. So we all have to gear up towards advocacy for improving the child tax credit and other policies that can help children and families before then. So those are the two things where I see a lot of opportunities that we should be paying attention to.
Great. Thank you. Will everyone give a round of applause for our amazing panel? It was just so powerful hearing from all of you. I think I heard over and over again that we know what to do in the policy space in terms of reducing or eliminating child poverty, encouraging and facilitating child well-being. We need to be led by and listen to the real experience of people who are living in poverty or with low incomes. We need to think about how we connect the dots between income and family and community wealth and success over a life course, over generations, and that we really have to think about our shared goals around family well-being, child well-being, caring for our kids in a way that create success and thriving families and children. So that all gives me a lot of hope, and I think provides a strong foundation as we continue the work of the council. So thank you all so much. We're now going to take a short break, and we will reconvene at 2:35 for the next panel. Thank you.
All right, well, welcome back from break, and please join me in welcoming our second panel, and I'm going to turn it over to you, Secretary Manesse.
Thank you. Good afternoon. Thank you to our panelists for being here this afternoon, and to the previous panel. Excellent comments, wouldn't you say? Absolutely. My name is Gila Meneses. I'm the State of Washington Secretary for the Department of Social and Health Services. In order to frame this conversation, I was asked to give you a quick briefing on what we've done in the state of Washington in the area of reducing poverty. And I'm pleased to tell you that a few years ago, the state legislature and the governor established what we call the Legislative Executive Workforce Poverty Reduction Oversight Task Force, woohoo, otherwise known as LUPRO. And LUPRO established the Poverty Reduction Work Group, which is the group that is actually the important group that is doing the work. That group consists of people with lived experience, a few agency heads, and Lori Finks, who reports to me. But the important part of that group is truly those with lived experience. As we've heard this afternoon, that is a key to understanding what we have to do, what we should do, and what the causes are. And so that group literally did that. They established a 10-year plan. And in order to do that, first they had to understand the root causes of poverty. And I think most of you know that one of the main root causes of poverty is not the fact that a person can't handle their money, but rather racism and inequality. So that was the first task. What are the causes of poverty? And mind you, there are other causes as well, but those are the root causes. So that was the first thing that group did. And then they started putting together the plan. And I have to say, they've done an exceptional job, and we've seen immense difference. The plan consisted of several recommendations, including some which we heard this morning or this afternoon from the previous panel. It required or suggested funding the Working Families Tax Credit, modernizing our IT system so that we could provide benefits more quickly to our clients suffering from poverty, sizable investments in affordable housing, childcare, and healthcare, increases in cash assistance, as we heard this afternoon, for families, people with disabilities, and immigrants and refugees. In other words, treating the whole family so that we can treat the child. Exploring the potential of state basic income and investing in a local basic income pilot. Providing adequate compensation for people with lived experience when they join groups like this. Family caregiver assistance or compensation, as well as paid medical leave. So those are some of the recommendations that we have implemented in the state of Washington. So I'm proud to say it's making a difference. Over $3 billion in investments, and we're seeing reductions in poverty in the state of Washington. So with that, we're going to hear from our distinguished panelists. We're going to start with, I'm going to give you a very brief summary of their exceptional credentials, but the full credentials are in your packet. Cindy Long, the Administrator of Food and Nutrition Service, the U.S. Department of Agriculture, one of our important partners. Thank you. We have Dr. Michael Warren, is the Associate Administrator of the Maternal and Child Health Bureau, and part of the U.S. Department of Health and Human Services. I understand that your mission is to improve the health and well-being of America's mothers, children, and families. Thank you. We have Raj Nayak. Raj is the Assistant Secretary for Policy in the Office of the Assistant Secretary for Policy at the United States Department of Labor. Previously, he served in a range of senior roles at the department during the Obama-Biden administration. Anne. Anne. My dear Anne. I stood her up for coffee this morning. Anne Flagg serves as the director of the Office of Family Assistance. Prior to her appointment in the Biden administration in July 2022, she served as senior director of policy and practice at the American Public Human Services Association. And then we have Greg Lieserson, Deputy Assistant Secretary for Tax Analysis at the U.S. Department of Treasury. Prior to his position, he was a senior economist at the White House Council of Economic Advisors and the Director of Tax Policy and Chief Economist at the Washington Center for Equitable Growth. Thank you all for being here. Okay, with that, we have some important questions. Cindy, you will start us off by sharing the vision and priorities related to reducing child poverty and improving child well-being for the Food and Nutrition Service.
Great. Thanks so much. So broadly speaking, our vision at FNS is to achieve an America where everyone has nutrition security. And what we mean by that is that everyone in this country, no matter where you are, where you live, who you are, you should have access to adequate food and food that puts you on the path towards a healthy lifestyle. And of course, supporting healthy kids is a critical part of that vision. You know, we need to support kids with good nutrition to meet their needs of the moment, but also to put them on a path toward a healthy and successful, including an economically successful life later on. So in terms of priorities, there are quite a few. You know, we have a whole suite of programs that range from the SNAP program, the WIC program, the school meals program that are critically important in supporting that goal of getting kids on the path towards a healthy lifestyle. And just to highlight a couple of the ways we're seeking to strengthen those programs, you know, in the school meals program and in the WIC program, we are currently involved in updating the benefits to reflect current nutrition science. And that, given the number of kids that participate in those programs, we believe that will have a very significant impact. Again, on the school meals front, we are doing everything we can to support a trend that's happening around the country to provide healthy school meals for all kids, meaning to no longer treat it as a means-tested program, which has benefits for all children, obviously, but has some really important benefits for low-income kids in terms of reduced stigma and improved access. We also have an amazing opportunity, thanks to actually bipartisan action by Congress last year, to address hunger in the summertime, which we have known for a very long time is a serious problem. The risks of food insecurity for kids go up substantially during the summer. And Congress expanded the existing program we had, which historically has only been able to serve 1 out of 5 or 6 kids who rely on school meals. And perhaps most importantly, we are now able to, starting this summer, make available to every family with a free and reduced price children an EBT card for them to buy groceries to help replace those meals. In the WIC program, which is another critically important program that serves over half the infants in the country, we, thanks to the American Rescue Plan, have made a significant investment during this administration in modernizing the program and expanding outreach, because the program currently only serves about 30% of eligibles. And again, as I said, SNAP is, you know, strengthening SNAP, modernizing SNAP, working with the states on service delivery and SNAP is critically important, because that's a program that serves over 7 million households with children. So I could go on and on, but I will stop there. Some of my other panelists have a chance.
Thank you. Thank you very much. I hear you saying you're providing strong emotional, physical, and brain nourishment to our children.
That's exactly right.
All right. Dr. Warren, please tell us about the Maternal and Child Health Bureau's vision and priorities related to reducing child poverty.
Sure, thank you. Well, good afternoon. Our mission at the Maternal and Child Health Bureau is to improve the health and well-being of all of America's mothers, children, and families. And we envision a country where all children and families are thriving and reach their full potential. Our roots go way back. I was just talking to my panel colleague here. We got our start in 1912 at the height of the progressive era by a group of social workers who had worked in settlement houses in the Midwest. And there was not a home for children and child well-being within the federal government at that time. one of the first tasks of the Children's Bureau staff was to go across the country and document some of the challenges around problems like infant mortality. And even then, 110 or so years ago, before we were using terms like social determinants of health, they came up with findings like infant mortality is inversely related to family income. So the very same conversations we are having today. So I hope that the colleagues who come after us in 110 years are not having the same conversations that we are having now. If I fast forward to today, we still do data collection as part of the work we do. We have something called the National Survey of Children's Health. The most recent iteration of that survey showed that 44% of children in this country live in households that have experienced material hardship, so difficulty accessing basic needs like food or housing. 9% of children live in families where there is medical hardship, so trouble paying medical bills or for needed care. And we know that's so vitally important, particularly as we think about the link between medical debt and bankruptcy. So what are we doing about that at the Maternal and Child Health Bureau and HRSA? Part of our work deals with those immediate needs that are in front of us around access. So what do we do in the moment? HRSA-funded health centers provide vital care for people across the country. You've probably heard of our federally qualified health centers or community health centers, where many Americans are served on a sliding fee scale that is responsive to the resources that they have and driven by the needs of that community and designed by people in that community. We also support access to preventive services through our Women's Preventive Services Initiative and the Bright Futures Preventive Services Guidelines for Infants, Children, and Adolescents. When the Affordable Care Act was passed in 2010, those sets of preventive care services were outlined as services that had to be provided by the vast majority of payers without any cost sharing to individual patients. So it's absolutely essential that those preventive services are provided, and this legislation, now law, makes cost go away, and we support those guidelines, which are updated on an annual basis. So those things support direct access to care and what needs are present for families in the moment. But we strongly believe that it's important to look upstream. And so how do we prevent bad things from happening? That really is the crux of the work that we do in public health. We talk about primary prevention, preventing disease before it ever happens. You could extrapolate that to preventing other adverse outcomes before it ever happens. And so particularly in this space, as we think about child poverty, we think about two generational approaches, like our maternal, infant, and early childhood home visiting program. I'm a pediatrician by training. I can tell you I have never met a new parent who is not stressed in some way. And I will tell you also that I didn't have the resources in a 15 or 20-minute office visit to be able to help them get over most of those stresses. But I had the good fortune in medical school to travel out with home visitors from the county health department and to see the amazing work that they could do. I actually went out on a home visit with a family I had seen in the newborn nursery. And turns out really not much of anything I did in the newborn nursery mattered, but what that home visitor did in terms of helping that family find access to resources like WIC, to find accesses to pay for their heating bill, mattered a whole heck of a lot. And so we support the Maternal, Infant, and Early Childhood Home Visiting Program with grants to 56 states and jurisdictions that really supports a two-generational approach, not just thinking about the baby and the toddler, but also the family that surrounds them. And when Congress authorized this program, one of the benchmarks that we work toward is improving family economic self-sufficiency. So we think this is a vital tool in addressing poverty. The other thing that I'll tell you about briefly is our infant toddler court initiative, and this gets to the comment that my colleague in the earlier panel was talking about in the child welfare system. We know that many times the appearance in the child welfare system and in child and family court is really a symptom of a much broader problem. And so we have heard from folks over the years who say, we keep seeing families over and over and over again, and judges who say, there has to be a better way to do this. My traditional tools aren't working. So these infant toddler courts help get to the root of the issue. They look upstream. So is it housing? Is it job training? Is it access to medical care? Is it treatment for addiction or dependence? What do we need to do to support that child in the broader family context to be able to help them not be back in the same situation again? So appreciate the opportunity to be here and look forward to the conversation.
Thank you, Dr. Warren. I very much appreciate your emphasis on prevention and, again, putting the family around the child. Thank you so much. Raj, can you describe the U.S. Department of Labor's key strategies and actions for addressing poverty economic stability, and child family well-being.
Thank you so much, and thank you for having me today. At the Department of Labor, we don't always lead front and center with children and families in our mission, but they are at the heart of our mission, which I'll paraphrase a little. The three pieces are, we want to protect the wages, benefits, and retirement savings that workers are owed under the law. We want to ensure workers can come home at night safe and sound and provide them for their families. And we want to help workers get good jobs that help them take care of their families. That's kids, parents, and everyone in between. I want to focus on a little bit of that last point today. We've always had really important job training programs at the Department of Labor. We work with the state workforce system around the country. We're lucky to have great partners at HHS and Ed in administering that system. But in this administration, we've been looking for ways to bolster that last part about good jobs, because we know that we need good jobs around the country, including for underserved communities, to promote this broader effort toward eliminating kind of poverty and child poverty in particular. In January 2022, we launched what we call the Good Jobs Initiative, which is an initiative which we have working with agencies across the government to help ensure that there are good jobs coming from federal projects. And right now, with the tremendous investments from the Invest in America agenda, the Build, CHIPS, and IRA investments, that's trillions of dollars of a once-in-generation kind of pot of money that we can use to leverage those funds to create good jobs and strengthen and expand the middle class. This Good Jobs Initiative isn't all new work for us. Our Wage and Hour Division, for example, has always worked with other agencies in providing technical support to say, like, how do you implement the Davis-Bacon Act for prevailing wages? Our Office of Federal Contract Compliance Programs has always worked on-site with agencies for decades. But we're drawing more attention to this work, given, again, this once-in-a-generation opportunity. One key strategy from the Good Jobs Initiative for us is working with other agencies to help add job quality to their funding opportunity announcements. What that means in practice ranges widely, but with some agencies, that's the Wage and Hour Division helping them, again, to comply with Davis-Bacon prevailing wage laws, or the Employment Training Administration to help folks think about how to integrate registered apprenticeships to build up new career pathways to make sure we have the trained workers for these jobs. For other agencies, it's working with our Office of Federal Contract Compliance Programs, which has a mega construction project program, which will really help new construction projects build in outreach requirements so that they're getting new and different voices, new and different communities into those jobs. Or to adopt local hiring provisions to make sure that the community that's surrounding the development of a new project, for example, gets those great jobs that come from it. We've also been exploring ways to promote the benefits of empowering workers, whether that's community benefits agreements or even neutrality agreements, so that the jobs created by these new projects could potentially be union jobs if the workers choose so. In doing this work, we've built MOUs with 5 federal agencies now, with Departments of Transportation, Energy, Commerce, Interior, and the EPA. And we've been working with them to, again, find ways to build these sorts of incentives or requirements into their funding opportunities. As of June of this year, $181 billion in Invest America funds have these sorts of equity or job quality incentives across 91 funding opportunity announcements. You can see more about the particular provisions that agencies are putting in and the kind of overall impact at our website, goodjobs.gov, and we're happy to talk more about it. Thank you.
Thank you, Raj. And particularly with the staffing shortages in the United States, this job training is essential. Thank you so much. And what are the key strategies and actions that the Office of Family Assistance is taking or planning on to take to address child poverty and well-being?
There are going to be really common themes across certainly the prior panel and everyone here. So the economic stability and mobility, I think we've heard from a range of examples, is sort of the most fundamental driver of outcomes in the health space and employment. And if folks can't, if they're not stably housed and they can't meet basic needs, the rest becomes much, much harder to accomplish. So really thinking about how do we better leverage the TANF program to meet those economic stability needs in communities. The other piece of this is prevention. I think the other key theme is prevention, much of which I think was so beautifully covered by Wisconsin over there. But thinking about, similarly, we have a big program in TANF. It was very interesting to hear, Wendy, your example of TANF being the backdoor to child welfare for families potentially at risk of involvement in the child welfare system. And what's interesting is the first purpose of TANF is to prevent children from being removed from their homes. So it shouldn't be the back door. It should be the front door every time. So we're thinking about strategies to support the field and lifting up good examples where that model has already shifted and providing more supports to states who are interested and jurisdictions who are interested in carrying that forward. I think the other comment I'll make, excuse me, the other comment I'll make is around the access to TANF. So TANF, of course, was passed in 1996, and it has been, let's say, a static program with very minimal changes to the rules. What has changed is how the dollars have been spent and how many people are now accessing it. So Wendy's example of, in 1996, 80 people out of 100 who would likely be eligible receiving the benefit, now to being only 20 of the 100 people who would likely be eligible, is not a unique situation. It is very close to the national trend. So how can we make sure that we're connecting more families who could be eligible for this support to supports in ways that meet their needs and their goals for their family? I think the other thing I'll note is sort of this 2-gen approach or whole family approach, which is sort of a key feature of ACF's strategic plan. And it's just interesting because the TANF program is completely focused on the parent and only measuring the success of the parent, and really only measuring not the success, the participation of the parent in the required programs, with little ability to connect to outcomes and to connect for the parent, and to connect how participation in employment and training and wage gain impacts all of the other child well-being outcomes that we know are certainly impacted when parents have access to greater opportunities. So I'm going to make one shameless plug, which is we have been given an opportunity through bipartisan action in the Fiscal Responsibility Act to pilot new performance measures in 5 states for the TANF program. And it actually gives us an opportunity to test out some family well-being measures. And this is a really exciting opportunity where we might get to look at what are the whole family outcomes, where we might get to articulate how investments on that front end impact the downstream. So there's an RFI coming out in the next week or so, and we'll be sure to share that around with ASPE. But welcome everyone's input in how to better measure family well-being.
Thank you. Thank you. When you say you concentrate on the parent, I get in my head, I think of the analogy of if you're on a plane, you're told to put on the oxygen mask first, and then take care of the child or the people around you. Thank you very much. That makes a lot of sense. Greg, will you please talk about the lessons Treasury has learned from the expansion of economic supports during the height of the pandemic, particularly the expansion of the child tax credit?
Well, thank you. It's a pleasure to be here today for the kickoff of the Children's Interagency Coordinating Council. The Treasury Department, through the Internal Revenue Service, plays a critical role in federal efforts to reduce child poverty and improve child well-being. Of course, the Earned Income Tax Credit and the Child Tax Credit are among the largest federal anti-poverty programs today. A substantial share of the economic support provided during the pandemic was run through Treasury and the IRS. During 2020 and 2021, the IRS issued 3 rounds of economic impact payments, also known as stimulus checks, totaling more than $800 billion. And each of those rounds consisted of a payment per taxpayer plus an additional payment for each qualifying child in the family. During the second half of 2021, the IRS issued advanced child tax credit payments totaling more than $93 billion to more than 37 million families with more than 61 million qualifying children. One of the most important things Treasury learned from this experience is how to get this relief out quickly to the families that need it. In 2020, it took only 2 weeks to issue the first direct deposits. That was a considerably faster timeline than it was in 2008. And there were a number of contributing factors to that, both in terms of how the legislation was written, the attention of the legislation to questions of administration and implementation, and the design of the program and the commitment of the administration to getting it out quickly. Treasury also learned a lot about what it works to reach as many eligible families as possible. So the tax system is organized around a voluntary self-reporting system. People show up and file for benefits, but in this context, many of the eligible folks do not have a filing requirement, and so the question of how we can make sure these benefits were reaching each and every family that needed them was central to how we were thinking about administering these programs. We had success with a number of different approaches. I'll emphasize 3: simplification, engagement, and targeted outreach. With respect to simplification, the IRS issued guidance and created online portals to facilitate simplified filing of returns for folks who were not required to file an income tax return on their own. That unlocked a variety of approaches, both including private sector partners who created their own tools and wraparound services to help folks get in the door through that means. With respect to engagement, the IRS and partners in nonprofit organizations, churches, community groups, and others hosted events to help eligible families file simplified returns, provide information about these credits and what they were eligible for, to encourage folks to come in and claim those benefits. And then with respect to outreach, my colleagues in Treasury's Office of Tax Analysis identified individuals in the tax data who looked like they were eligible but had not claimed benefits, and reached out to them to alert them to the fact that they may well be eligible for these benefits, and to come in and apply for those benefits. So I think sort of across a range of approaches, learned a number of ways we can make sure we're reaching everybody, help folks get the benefits that they're entitled to, and sort of build some of those muscle memory for future rounds. I mean, I fully anticipate that there will be rounds of relief implemented through the tax system in the future as well, and we're hoping that each time that happens, we'll be able to build on what we've done in every prior round to make sure more people receive the benefits and the support to which they're eligible, and which will help them and reduce child poverty and improve well-being.
Thank you very much. And 2 weeks for direct deposits, online portals, so that supports my earlier point of IT transformation being critical. Thank you so very much. So now we're going to have a full panel of discussion. We're going to start with one question and then with Cindy, and then follow with the others. This is the question: how could interagency collaboration support and enhance your agency's work related to child poverty and well-being? And are there examples of interagency coordination that you'd like to highlight as good models for the CICC?
Yeah, I think when I saw that question, I thought about what do we hear from program recipients, from those who operate the program at the state and local level, about what they would like to see in terms of collaboration across federal agencies. And I think I thought of things, there's probably a number of things, but 2 things you hear over and over again is folks want the federal government to speak with one voice, be consistent. And we all know that, like, when you go from program to program, sometimes there's different definitions or different processes because that's how the statute is designed, and it is what it is. But there are certainly areas where we could probably do better in terms of, again, that kind of speaking with one voice. One example where I think this is important is, USDA and HHS collaborate on the dietary guidelines every year. And because that is and has been for decades been a joint effort, we use the same language, and we're all sort of referring to the same kind of, guiding principles for what constitutes good nutrition, and that underpins all kinds of program activities across the government. Another theme I think we hear a lot is about seamless service delivery across the federal government, and that one thing that often comes down to is data sharing. And there are lots of ways I suspect that we could improve data sharing across the federal family, but at FNS, our programs actually are operated at the state level. So one example that comes to mind for me there, and I think frankly, collaborating across agencies at the state level has the same challenges that it does at the federal level. But we, about a decade ago, we started doing something called direct certification for school meals. And that is where kids could become eligible for free or reduced price meals by virtue of them being identified as being on SNAP or on TANF or several other means-tested programs through data sharing. And we started at a level where about 60% of the kids who could be identified that way were, and we're now well over 95%. And that's the result of putting in a decade plus of work at the federal level to support states working together with grants, with technical assistance, and also the hard work at the state level to have that collaboration not only around the first step, but that sort of continuous improvement process where we saw that increase from 60 to 95.
So I appreciate this question, and I think, as my colleague said, finding out from our state and local partners what they need, and I would also say finding out from families what they need. And we know that kids and families don't live in the silos in which we operate, right? They don't exist by legislative authority. They don't wake up and say, it's my Medicaid day, or it's my WIC day, or it's my day to access public transportation. They're navigating all of those things multiple times within the same day. And so they are expecting all of us to get that right and work together. I think there are a lot of examples currently where that is happening and happening well. I can share a few of those with you. I mentioned our home visiting program earlier that's authorized. It's a formula grant program to states that we administer out of HRSA. Our partners in Medicaid, as it turns out, have the ability to be able to pay for parts of that home visiting work, particularly around targeted case management and care coordination. So what we did a number of years ago was to develop joint policy between CMS and HRSA to be able to give states a roadmap that said, here's how you do it, and by the way, it's okay. We're not going to ding you if you braid your funds in this way. States wanted to do this. They were hungry to do it. They knew they could serve more families and stretch our very limited, precious federal dollars further if they were able to do this. So giving them the permission to do that and showing them the course to do that really has expanded the number of families that they're able to serve within a given state. Even more recently, with my colleague Miranda Lynch-Smith, who you heard from on the earlier panel, we've partnered with her team at ASPE to think about this space of early childhood and all the various agencies that serve families with young children across the federal government, and how do we achieve collective impact? What does that look like? Thinking about eligibility requirements, thinking about performance measures. Having been on the receiving end of federal grants, I spent about a decade in state government before coming to federal service. I can tell you nothing is more frustrating than having 2 or 3 federal grants, all with different reporting deadlines, all with slightly different performance measures, and the amount of work you spend trying to keep up with that is mind-numbing sometimes. And so getting our federal partners on the same page has been key. And with Miranda's leadership and the work of ASPE being able to do this collective impact work, I think we're on a good trajectory to be able to do that.
Thank you.
So I was going to focus a little bit on the second part of the question, which is examples of interagency coordination that I've found helpful. In this administration, one of the things that we've been working on at the Department of Labor is, at the beginning of the administration, President Biden announced a new task force on worker organizing and empowerment. He said, I'm going to launch an all-of-government approach to tackle this issue, which in this case was to encourage worker organizing and collective bargaining. So again, thinking about like how do you get all the agencies together to do something specific. In this case, the task force was chaired by the Vice President and vice chaired by the Acting Secretary of Labor. First, they said, okay, agencies, go off and submit recommendations for how do you do this. Like, look at your authorities. You still have to be grounded in the work that your agency already does or could do. But if you're going to think about empowering workers, what steps would you take? There were kind of 4 important parts of this task. One was setting a clear goal, right? This is about empowering workers. And that, as we could talk about, has different potential ancillary effects and impacts, which is great. But they said focus on this one clear goal as what you're headed toward. We're looking at a core metric. They said we want to see like how these actions would affect union density, which isn't in the the direct kind of purview of many of our agencies. But they said that's what we want you to think about, where you're headed here. We want you to report back to the president on what you're doing, and we're going to tell you, update this regularly on your progress. So having kind of a clear goal, having clear metrics, having a clear kind of reporting structure, and just the mandate to update, I think led to some success here. It got agencies to look carefully at what they could do, again, still consistent with the work and their authorities that they already have. For example, the folks at Treasury just released a great report on the relationship between union density and middle class stability and growth, which is something that that they had the research to be able to back up. At the Department of Labor, we developed something called the Work Center, which is a one-stop shop for workers who want to understand their organizing rights and also employers who want to understand what their rights and responsibilities are under the law. For us, this is work that connects back to our authority because workers who, kind of have unions or have the right to organize are more likely to be able to work in healthy and safe workplaces, right? They're going to speak up if there's a health and safety hazard. They're going to let people know if they're not getting the wages and benefits that they're owed. And so in this case, we were able to launch these new initiatives. We were able to report back, to the interagency structure and find some new opportunities to advance the administration's goal. And so in thinking about ways council could work, telling people here are your very clear goals and metrics is a good place to start.
All right. So I'm going to go out on a limb and I'm going to use a labor example here as a great example of interagency coordination. So in 2014, when the Workforce Innovation and Opportunity Act was passed, it required Department of Labor, HHS, and colleagues in ed overseeing vocational rehabilitation and adult learning to coordinate around career pathways and workforce development programs. So it's great for HHS, right? We just heard about the Good Jobs Initiative and recognizing that the communities that we serve are often excluded from the pathways to get to those good jobs. So that gives us an opportunity to coordinate right there with our partners and create those pathways where they wouldn't have otherwise existed. But the thing that, maybe two things I'll note about it that I think have been incredibly helpful and things we shouldn't underestimate. So the first is there was a requirement for coordinated state plans. So states all have to put their plans together, and it has normalized, exactly to your point, Dr. Warren, it's normalized reporting timelines, performance metrics, so you can start to see client data across those systems. And we shouldn't underestimate ourselves as models for what happens in state government, because now this WIO structure is passed through to state agencies. So every state agency has a similar coordinated committee that's doing that work on the ground. Because frankly, we can coordinate amongst ourselves all we'd like, but if that's not translating to the communities that we serve, then that's not the impact that I think that we all want to have. So I think those kinds of very practical requirements and modeling can really make an enormous difference.
I'm going to return. I'm going to return to a theme that Cindy mentioned a few minutes ago about data sharing. One of the areas where Treasury has benefited a lot from interagency collaboration is improving uptake and reducing taxpayer burden and making sure folks get the benefits they're entitled to. And data sharing has played a big role in doing that. To use the example of the economic impact payments, their Treasury worked with Social Security Administration, the Railroad Retirement Board, and the Department of Veterans Affairs to issue payments to beneficiaries who had information with each of those agencies, so that folks who did not need to file tax returns, which includes a lot of folks on Social Security or retired, were able to get benefits without needing to take up the burden themselves. We also worked with CFPB and other departments and agencies within the Interagency Council on economic mobility, including USDA and HHS, to get the word out to vulnerable populations for all of those programs as well. And so I think this is one area where Treasury and IRS, and thinking about tax administration, which has not historically had quite the same uptake mindset as some of our partner organizations and agencies across the federal government, can learn a lot from the wisdom and expertise of other agencies, as well as leveraging data sharing opportunities in specific areas where they're available, to really help ensure that folks get the benefits they're eligible for.
Excellent. So I hear data sharing is a common theme, the importance of accurate data. I agree with that. And I also hear coordination not just within the federal agencies, but with other federal agencies and states. Critical. That's the collective impact, isn't it? And possibly community. So thank you. Thank you. So our last question is, how has your agency involved states, tribes, communities, families, and individuals with lived experience to inform your goals and priorities related to poverty and child and family well-being? Cindy.
Yeah, we certainly are committed to hearing and learning from those that we serve. But I think what I'll focus on is specifically some of the work we've done during this administration to do a better job of that with our tribal nations. We have, for quite a long time had some of the sort of basic things in place. We would do, required tribal consultations and things like that. But in the last 2 years, we've really, number one, strengthened our capacity in the agency to do that work. We at FNS, we have 7 regional offices, and so we have now hired 7 tribal specialists to work in each of those offices, and they really are charged with, their job is all about establishing and maintaining those channels of communications, visiting the tribes where they live, seeing their experiences, hearing how they're experiencing our program. I will also share that one of the things in doing that, we took a real hard look at how we were hiring, and while we don't have the authority to specifically hire tribal members, we really did strengthen the criteria so that folks did have to have a deep understanding and knowledge of tribal communities. And we have a lot more work to do, but we've also identified some simple things we can do, like providing technical assistance materials. And sometimes we fall into the trap of like, okay, if we're going to do tip sheets on how to use this product, you pick the ones that are the most popular, right? Like, let's do one on apples. But we've done a lot more work about how to use indigenous foods in our programs, which may not be applicable everywhere, but it is something that is tremendously important to our tribal partners. And that's just one example of something that I think of as kind of even low-hanging fruit, is to just think very specifically about what we are hearing from our tribal partners and how we can integrate that into what we're already doing in our programs.
Excellent, thank you.
I think this charge to engage folks with lived experience certainly is very strong within HHS, so flows down from the Office of the Secretary and through our HRSA leadership. A few examples of what we are doing at HRSA, a number of listening sessions over the past few years to engage folks in states and communities, and not only our awardees, which may be, for example, state or county health departments or academic institutions, but also the recipients of those services to understand what's working well, what could be better, resulting in things like longer grant application windows. People say, we want to do a good job writing your grant application, but you give us 45 days to be able to do that. So we've been able to double that effectively in our bureau to 90 days for all of our planned grant applications. We also have gone where the communities are. So we have an advisory committee on infant and maternal mortality that since its inception has always met in Rockville, Maryland. We recognize that if we think about the charge of this committee looking at infant and maternal mortality, there are marked disparities. And so we wanted to go to communities where those disparities are prominent. So for the first time last year, we traveled to Minnesota, to the Shakopee Midwakaton tribal community at their invitation, and held the advisory committee meeting there, which gave a very different picture of the challenges around infant and maternal health and what we might do to address those disparities. We've also worked hard to assure that on our federal advisory committees, we have family and consumer representatives as voting members to be able to be an equal voice at the table to help drive the policies that are being made. Our largest investment in the Maternal and Child Health Bureau is our block grant to states, and for years now we've had a commitment to include in the annual review not just a federal project officer, but also a family reviewer. And I'm happy to say that now in more than half of the states and territories, we have a family reviewer present for those annual reviews. They bring a really unique perspective to be able to share their lived experience and ask the kinds of questions that are helpful to move the states and territories along in making sure their work is really centered around the needs of children and families. And then finally, I want to just echo a theme that you heard from Takoria in the earlier presentation, that it is vital that we compensate families for their engagement in this work. We wouldn't think about pulling another consultant up to the table and not ask them what their fee was. Families come with incredible depth of knowledge and lived experience, and we should pay them accordingly for that and for that specialized expertise as consultants. We've been doing that in our committees for a while. We encourage our grantees to do it and have been making sure they know that is permissible use of our federal funds, but it really gets at this notion of honoring that lived experience and helping to recognize that.
You know, I think focusing on that question of how we get input from impacted communities, you know, we've been thinking a lot about this in terms of policy making and even rulemaking at the Department of Labor, not just because it's good for kind of being responsive and small d democracy, it's just better for policy, right? If you actually hear from people who are impacted by the laws and the rules that we're trying to make. We have a great history at the Department of Labor of getting lots of good feedback when we do, for example, rulemaking. We get feedback from the industry groups, we get feedback from workers and unions and other great folks. But we don't get as much feedback from actually, you know, the actual workers who are impacted, or even kind of individual small businesses. We get to hear this through intermediaries. So we've been thinking about how do we make ourselves more responsive and kind of more accessible to folks who are actually impacted by those rules. So we've taken a couple of different strategies. One, we just very basically kind of put together a website that says here are the rules we have at any given time that are open for comment, so that when we're going around to talk to people, when we're talking to people in communities, when our colleague Brent is talking to people out in the states and localities, he can say you can hear more about this. You can go to dol.gov/regulations. You can please take a look, and we try to link to the rule and to more plain language materials to say here's how you can submit your comments. We've also tried to put some resources on that website just to say, here are your more plain language, here's how rulemaking works. But the third thing is we're just doing more stakeholder meetings, and we're doing them more by WebEx, at night. And so after this, I'm going to head to a meeting from 5:30 to 7 tonight about opportunities for people with disabilities in the workplace. So we're trying to take different tacks to get more voices into the policymaking process.
So I think the first thing I'll say is who we are as federal employees kind of matters, right? And what's our composition, and how do we create more opportunities for individuals who have experienced our programs to become a part of our workforce. I mean, there's certainly, yes, there's so much value having lived expertise, as consultants, but who we are makes an enormous difference. So we've been thinking a lot about how do you create job descriptions that are welcoming? How do we get out to communities to do recruitment events in places that have not been the traditional recruitment pipelines? And because who we are as the federal workforce matters, and how do we create those opportunities for folks with lived experience? And the other thing I'll say quickly is just when we think about the opportunity I mentioned at the top of defining outcomes for an enormous federal program, that needs to be driven by people who've experienced that program. Because I have ideas. Everybody in this room has ideas. But the only definition of success that matters is from the people who participated in those programs. So really centering that.
Great. So this is, consistent with what you've heard so far on this panel. Treasury has had great success in tapping into the expertise of folks with lived experience and understanding what works to help people get benefits. Taking the example of the child tax credit, community groups, national organizations, state and local governments, we're all critical partners in our implementation of that program. One of the key ways in which that partnership sort of played out was working with those groups to train navigators from the community that could help folks figure out what they needed to do to get the benefits, not just sticking another form on the IRS website, but what do we need to do to actually get through this benefit? And these navigators were trusted messengers in the community in ways that we as the federal government are not always trusted. And this also allowed us to tap into a array of language expertise that we don't necessarily have ourselves as well. And then finally, just sort of building as many events as possible, as many sort of decentralized opportunities to engage with us as possible, where folks can come in on their terms, on their times, sort of time of day, day of week, all of those options to make sure everything that we are doing actually works for the folks on the ground.
Excellent, thank you. Including people with lived experience and paying them, right? We're doing it in Washington, so we can all do it. Thank you so much to our panels. Okay, thank you.
Thank you so much. I'm really excited, energized, invigorated by thinking about having partners like this as we begin the Children's Interagency Coordinating Council. I want to thank all the panelists and moderators who've joined us today. We so appreciate your expertise, your time, and your thought. And now to usher in our keynote by the Honorable Barbara Lee, I would like to invite to the podium Jeff Hild, who is the Assistant Secretary and Principal Deputy Assistant Secretary at the Administration for Children and Families in the U.S. Department of Health and Human Services. Jeff.
Thanks, Jennifer. Good afternoon, everyone. So nice to be with you. And I have the great honor of introducing Congresswoman Barbara Lee. At the Administration for Children and Families, we engage every day with advocates and leaders who have dedicated their lives and careers to advancing equity and improving the well-being of children, youth, and families. We meet people who've been in this fight for a long time, who have stayed grounded through thick and thin, and who have, through their perseverance, made tangible differences in the lives of children, families, and people living on the margins. And one of those people is undoubtedly Congresswoman Barbara Lee. She has served in Congress since 1998, and her tenure has been marked by her relentless pursuit of justice and opportunity for children and youth in America, and for peace and prosperity all around the world. Back in the day when I worked for Congressman Pete Stark, who represented the neighboring district to Congresswoman Lee, we would often joke in our office that we had a friendly competition around who could come up with the better ideas for legislation to support families. We'd introduce a paid leave bill. Congresswoman Lee would respond with a free universal pre-K bill, and so it went. And she continues to this day to push forward bold but concrete solutions to help families. Congresswoman Lee embodies the ideal that standing up for your values sometimes means standing alone and persuading others to get on the right side of history. She also knows that poverty is a policy choice, and that ending poverty in this country is not only a moral imperative, but it's something we have the tools to do. As a member of the Appropriations Committee, she has been a leader in the fight to preserve and expand critical safety net programs like child care and SNAP. As chair of the Democratic Caucus's Poverty Task Force, she pushes policies and initiatives that help reduce poverty for children and families across America. When she speaks, it is obvious she has her ear to the ground and is talking to families and people who are most impacted by the policies we enact. She understands that poverty is the root cause of so many issues children face. As she has noted, too often children come into contact unjustly with the child welfare system simply because their parents are poor. So she fights for direct economic supports and universal, affordable, quality childcare because she knows how much it matters to the economic mobility of parents and the well-being of their children. When we talk about why, as this last panel did, it's so important to have people with lived experience making decisions. We look to Congresswoman Lee as a shining example. Ending poverty is personal for Congresswoman Lee, as she has shared, as a young single mother attending college and raising 2 sons, she needed assistance to make ends meet. She is a former social worker, and that becomes apparent when you hear her talk about the need to support our human services workforce. She gets it. She gets it. In graduate school, she founded a community-based mental health clinic. So when she talks about solutions springing forth from community, It's from firsthand experience. She continues fighting to protect bridges over troubled water for families so everyone has an opportunity to thrive. She invites all of us to be allies in the fight and pushes us to think big and act boldly. Her leadership is in fact the reason we are here today and that the Children's Interagency Coordinating Council exists. So it's fitting, therefore, to have Congresswoman Lee here today as our keynote speaker. Thank you, Congresswoman, for your leadership, for your service, for your character, and for your example. It is an absolute honor to welcome you to HHS.
Well, good afternoon. Jeff, first, thank you for that very warm and generous and humbling introduction. But also, as you were speaking, I'm saying, now, was this when I was a staffer to Ron Dellups and you were a staffer to Pete Stark? I've been doing this a while. So thank you for your leadership. God, it's so good to see you. It's good to see all of you. You know, I mentioned earlier that it's very seldom that I get a chance to be anywhere as an appropriator witnessing the results and the implementation of the work that I do. So this is like probably historic for me after 25 years. So you don't know what it means. It's really an honor to be here. Let me thank also my friend and colleague, your secretary, our secretary, Javier Becerra, and his wonderful team, all of you here at the U.S. Department of Health and Human Services, for hosting today's kickoff event for the Children's Interagency Coordinating Council. Secretary Becerra, well, you know he's from California, used to be on the Hill, was our Democratic Caucus chair. I served in the legislature with him. And he has been a steadfast partner on so many issues that I work on, including our Democratic Party Caucus Task Force on Poverty and Opportunity, our quest to improve the well-being of our nation's children and to end poverty. And way back when he served 12 terms in Congress, and now as Secretary of the Department of Health and Human Services, I want to just tell you, he helped me form this task force because he knew that even Democrats weren't using, I say, the P word, and that's poverty. You know, we always talk about how we fight hard for the middle class, which we must do. But very seldom do we talk about lifting people out of poverty. And we fight for the poor, and we fight for low-income people. And so his leadership in helping me establish this task force was extremely important. As Jeff said, some of you may know, yes, I've had a lot of lived experiences. Actually, when I was raising my two little boys, who are grown men now, doing phenomenally well, I fell on some hard times, and I had to go on public assistance, as in, then it was AFDC, and food stamps while a student trying to build a better life for these little boys. When I was earning my degree, and I love sharing this story because childcare, I had to bring them to class with me because I could not afford childcare, okay? The lists were so long, the waiting lists, that probably after 4 years of undergrad and 2 years of graduate school, we barely got to the front of the list. And so that was then. This is now. Childcare should be universal, accessible, and free. And so it's not only a personal issue for me. As the richest nation in the world, it's a moral and economic imperative that our nation ends, and I don't mean reduces, I mean end child poverty. Children across the country, especially those coming from low-income families, they're just struggling to make ends meet. They're living on the edge. And I do work with Bishop Barber in the Poor People's Campaign because you know what I've learned by being an elected official, you have to have an external and internal coalition working to help change the world. And by changing the world, we need children. to be able to not only survive, but to thrive. And so Bishop Barber's campaign is extremely important to the work that you all are doing here. There are far too many children in the United States that grow up and remain trapped in poverty compared to other democratic countries. The loss of the expanded child tax credit, along with increasing housing and food prices and child care, continues to burden the most underserved children and families. In September 2023, the U.S. Census Bureau reported that our nation had a significant increase in child poverty, with 12.4% now of children living in poverty. This represents more than doubling of child poverty in 2022 from 2021, which is a significant backtracking from the progress that we made in 2021. The increase in child poverty, it's unacceptable. That's 1 in 6 children, and this affects children of color the hardest. Nearly 3 in 4 children are poor children are children of color. But the good news is that we know what works to combat child poverty. Poverty shows us, and Jeff mentioned this, it's a policy choice. We know how to reduce poverty when our country's lawmakers have the political will to do this. And you know what's happening now on the Hill. Today, the cuts, I don't even want to talk about it, it was so scary, that were made to the Labor, Health, and Human Services appropriations bill, where it was an immoral, it was a moral disgrace. So we have to have the political will to lift children out of poverty. So yes, as a member of the Democratic member of the Appropriations Committee and chair of our Poverty and Opportunity Task Force, I've been working to eliminate child poverty for years. We are the richest nation in the world, spending trillions of dollars on military weapons and endless wars, but won't extend the coverage of the federal child tax credit. So the 23 million children whose families earn too little to qualify don't slip through the cracks. So in Congress, yes, I fought to get the child tax credit expanded to cover all children. So we stop leaving out those who need the help the most. With its expiration, I have to pick up that fight again. The expanded child tax credit payments lifted millions, and you know this, millions of children out of poverty, driving down child poverty rate to a record low of 5.2% in 2021. Also in Congress, I've been advocating for us to redirect funds from our, it's close to $850-some billion military budget. It's bloated. And let me tell you, and I led the effort, and some people wonder about this because, you know, we need a strong national security, which we have and we will have. But we've looked at the Pentagon budget. There are over $150 billion in waste, fraud, and abuse. Taxpayer dollars just gone. Also, and you may not know this, but the Pentagon, the Defense Department was the only agency that's never been audited. So I had to work with a Republican colleague a couple of years ago to require the Pentagon to be audited. But guess what? They've been audited 5 times now and have flunked the audits. Okay? Flunked the audits. So you can't tell me that we don't have the investments toward putting additional housing and increasing access to benefits like SNAP and to end child poverty in this country. We have the investments and the resources to do that. Data for Progress polling shows that Americans agree 59% of Americans support using taxpayer dollars to end child poverty instead of funding our endless wars. Ending child poverty is one of the strongest moral imperatives upon us. It's one of the most possible actions that the government can take, giving us a clear mandate to take action. And so that's why every chance I get, every time I can figure out a way to put a marker on something that moves the needle, that I included in both the House and we included in the Senate 2022 Labor, HHS, Education, and related agencies, the bill, the appropriations bill to direct HHS, and I did this with retired Congresswoman Lucille Roybal Allard, who's a good friend who worked on poverty issues alongside myself for many years, to create the Children's Interagency Coordinating Council, and to foster greater coordination, collaboration, and transparency on child policy across agency lines. And you know, we were just talking in Appropriations Committee trying to figure out what to do next after we got the National Academy of Sciences to come up with the study which helped us drive the child tax credit. We said, we can't stop here. And Lucille and I were just saying, what do we do? What do we do? Well, we can figure out where some money is to set up this interagency task force. That's how it happened. So $3 million, not enough. Got to do more. But I'm so happy that you all are implementing this today because you're making a difference in the lives of children. And HHS has established now, thanks to you, this Children's Interagency Coordinating Council. And so thank you so much for heeding our call. And now the Interagency Coordinating Council, you have a lot of work cut out for you. A lot of work. Our children are currently facing some of the most challenging times seen in our nation's history. As such, they deserve our greatest efforts, our best thinking, and our most innovative strategies to meet these challenges. This can't happen if agencies and teams across administration work in silos. We're the wealthiest nation, as I said earlier, on earth, and we can protect the poor and the vulnerable children in this country. But it takes all of you. It requires your commitment day in and day out, and I'm so happy that you have that commitment and that you're kicking this off in this way today. And so stepping up now and coordinating to address these growing challenges, it's in your hands. All these challenges that we see kids facing today, they include rising rates of infant mortality, doubling of child poverty, increased food insecurity, youth mental health crisis, loss of children's health care coverage due to the unwinding of continuous Medicaid coverage, and so much more. And I come from, yes, the golden state of California, where we have 40 million citizens or residents. 20 million of the 40 million are one paycheck away from poverty, living on the edge. And these are families with children. So by enhancing the coordination and alignment of federal, state, and local anti-poverty programs, I am very optimistic that we can maximize the impact of every federal dollar in the fight against poverty. So this $3 million, I expect us to see 10 million in terms of the outcome. You all can also play a big role in strengthening federal oversight of anti-poverty programs by improving how the United States measures and evaluates the impact of these programs, as well as the long-term economic outcome of the Americans who receive this assistance. So I look forward to hearing from you on ways to remove barriers and obstacles that prevent children who experience poverty by joining the middle class when they are adults, because that's the issue. We want them not to have to be stuck living below the poverty line. So there's so much to do, but today let's celebrate the progress that we've made and recommit ourselves to fighting for our nation's children across the nation. So I look forward to working on more congressional efforts and with the administration to increase, yes, funding in our budget. I'm on the Budget Committee and Appropriations, and we're fighting every day right now just to tread water and not allow the cuts to take place. But we're also fighting to increase investments and resources for programs that can eliminate child poverty and improve funding to ensure that all children, as I said, don't just survive but thrive. So thank you all so much for everything that you're doing each and every day in your communities, your organizations across the country on behalf of children in this country. And I'm really happy that you invited me to be with you today, because once again, I said, for me personally, it's really a day for me to celebrate because of so many reasons, but I never get a chance to be with such great public servants who are implementing what we do in the House of Representatives and in the Senate. So thank you all again. God bless you.
Thank you, Congresswoman Lee, for your visionary leadership and for entrusting us with this responsibility. We're so excited to get to work here. And we are nearing the end of our program today, so I would like to invite back to the stage Miranda Lynch-Smith, who is the senior official performing the duties of the Assistant Secretary for Planning and Evaluation, and also the Deputy Assistant Secretary for Human Services Policy, so many titles, and she will be providing us some closing remarks.
Thank you, Jennifer, and thank you all for joining us today, whether you were here in person, on the live stream. It was truly an honor to come together today and be part of this Interagency Coordinating Council kickoff. I've learned so much from what was shared here today, and I hope you did too. I think we heard successes, challenges, opportunities, insights, things to really carry us forward as we continue to do this work. I think we really recognize that effectively reducing and eliminating child poverty and improving child well-being in our nation will take a collective effort and commitment across the federal, state, and community levels. And to create that transformational change, we will need to partner effectively across systems, align our goals and priorities, and leverage all of our resources and the vast investments that we already have into our safety net, social services, and income assistance programs. And we also heard very clearly that we need to meaningfully involve individuals and families who are directly affected by our policy making and make sure that they are at the center of the development of policy solutions and implementation and assessment of them so that we know whether we are successful. HHS will be coming out in the next few weeks to key federal partners about the next steps for ongoing meetings of the Coordinating Council. So we're not just going to talk about it, we're going to be about it. That's my commitment to you. We also want to stay connected to the broader community of individuals and organizations committed to this work because we know we don't do this in the federal government alone. And there are lots of partners out there that know how to do this work well, and we need to be in partnership and dialogue with them. We're going to send regular communications out to folks who registered for this event via a newsletter. We ask you to share that far and wide and invite others to learn about our progress together. And now I want to just really share my appreciation and a few reflections on the panelists and the conversations that we heard today. Really appreciate how much they enriched this event with their knowledge, expertise, and perspectives. First off, thank you so much, Congresswoman Barbara Lee, for your powerful keynote address, for always being in this fight, for being so dedicated and having such a sustained and steadfast commitment to supporting the Children's Interagency Council in the near term, but really your years of service to really eradicate poverty for America's children. What I heard in some of the comments that you said is that I was really struck by the external and internal strategy that you mentioned from the bishop. And I internalized that to think about the action that we need at all levels. Right? We need federal interagency effort to coordinate the policies and the programs that we're already doing. We need additional congressional action to help us focus the investments that we have so that they are most effective in reducing child poverty. We need to work in collaboration with policies, state and local agencies and leaders that are innovating at the state and local tribal levels, and partnership and guidance from our partners who are parents and families. So when we're operating at all those levels and all focused on reducing child poverty, we can be so much more effective in our task. I want to thank our federal panelists, Cindy Long, Dr. Michael Warren, Raj Nayak, Ann Flagg, Gray Lasison, for your insights and discussing how your respective agencies are approaching and advancing this effort. And thank you also to Washington Secretary Hilma Meneses for moderating that panel and sharing the lessons learned from the anti-poverty work in your state. What I heard from that federal panel is there's a lot of alignment already at the federal level in our programs. There's natural alignment about our goals and the outcomes that we want to achieve in having thriving children and families. And we have wonderful concrete examples of collaboration, of coordination, and a commitment to designing with families. So there's a strong foundation that we can build on, and we have to continue those efforts, be even more precise in how we can do that work effectively. I would also like to thank our first panel, Andrew Costin, Dr. Willie Elliott, Administrator Wendy Henderson, Tacoria Jones, and Dr. Dolores Acevedo Garcia. As a moderator of that panel, I was really impressed by all the work shared and the insights provided on how those state and local efforts really impact child and family well-being. And we heard from them clearly that it's really important to connect the dots between our federal programs to reduce the silos so that families don't experience our federal programs in ways that kind of chop up their needs, but look at their needs holistically, and to trust them to know what's right for their families, and really take those active insights from people with lived experiences in the work that we do. And thanks again to Dr. Acevedo Garcia for helping set the frame for our event today with your presentation on the report, A Roadmap to Reducing Child Poverty, and key developments since that publication in 2019. I heard there that we know what works, and we know where we're falling short. We have lots of evidence about policy approaches that help us reduce poverty, and we also know that they're not inclusive enough, that they don't ensure equity, and that there's more work to be done so that we have both income and supportive services approaches that really wrap around families to help provide them with what they need. I'd like to thank the other HHS leaders that provided remarks today, Rebecca Haffiji for the welcome, Meg Sullivan for the opening remarks, and Jeff Hild for introducing our keynote speaker. This event would not be possible without lots of people's help. We had excellent technical and logistical support provided by the HHS Studio and GovSpace teams and our contracted team from Mathematica and BLH Technologies. I'd like to recognize and thank our ASL interpreters that have supported us today to help make this kickoff more accessible. Planning an event like this is a lot of work. I have a fantastic team at ASPE that has been working to stand up the CICC as well as this event. It's taken many hours going over all the details to pull this off. I'd particularly like to acknowledge Gretchen Lehman and Abigail Matthew, who took the lead on planning and coordinating this kickoff. And finally, I want to thank our MC and my deputy, Jennifer Brzezinski. She's done a fantastic job of hosting this event, managing the flow and pace, making sure that everything ran smoothly and on time, and she's been an amazing counselor to me and support to our entire office in doing this work. So it's truly my honor to work alongside her and see how she supports our staff and keeps us all focused on our goals, which is really to ensure child well-being and the best research and evidence and practices that we can bring to that work. So that's it. Before we adjourn, can we please just have another round of applause for all of our speakers and our helpers today who contributed to making this a success. Thank you so much. Have a wonderful afternoon. Take care.